Hello guys, good morning, assalamu alaikum. My name is Dr. Faraz Ahmad, and today in this video we will discuss about a letter to the occupational therapist. So guys, 2 days back I uploaded a task in my Facebook group, and many of the people, almost more than 90% people, were writing the introductory paragraph in a wrong way. So most of the people were writing, I am writing to refer, I am writing to refer, I am writing to refer. But keep in mind, this was not a referral letter. This was a request letter to the occupational therapist. You was requesting for workplace assessment. So let's move to the case note and let me tell you how to write this letter. So this is our case note, and we will see how to write this letter from this case note. So guys, as you all know that writing time is almost 45 minutes, and this is important point that in first 5 minutes you are not allowed to write or underline anything on your case note. In first 5 minutes you have to do what? You have to just read the case note, and after 5 minutes you can underline, you can mark, or you can make notes on your case note. Okay. So guys, as I have told you multiple times that when you start writing, don't start reading your case notes. You have to do what? Just move to the writing task. First of all, move to the writing task and read the task carefully. So let's read it now. Using the information in the case notes, write a letter to the MS Jane Graham, an occupational therapist. So from the writing task, you came to know that it's a letter to the occupational therapist, and you are detailing Mr. Jones' situation. So in this letter you are writing the detailed condition of the Mr. Jones and requesting an assessment of his workplace. So there are two things which are important in this letter: detailing about Mr. Jones' situation, and you are requesting for assessment of his workplace. So after reading the writing task, I have told you multiple times that you should just move to above the writing task and read the plan of that visit. So here a treatment plan is given: return to work if no lifting or with regular breaks. So here plan is saying that patient can return to his work if there is no weightlifting and there are regular breaks. Secondly, a letter to the occupational therapist requesting workplace assessment, again the same thing which was given in the writing task. And there is another important thing, that is you also want advice on duties that patient can perform. So guys, these are the important information which are given in the task, that is occupational therapist. You are detailing Mr. Jones' situation and you are requesting for assessment of his workplace. Secondly, you are also seeking an advice on patient duties which he can perform. So after reading the writing task, you get an idea about your letter, that it's a referral letter, it's a discharge letter, it's a request letter. You get this idea after reading your writing task. Then after reading the last plan, you get idea that what you are going to write in the introductory paragraph. So you are going to write a request for assessment of his workplace and advice on patient duties. Okay, so let's move forward. Then you have to read the whole case note before start writing. Okay, so here I have underlined important information which you will include in your letter. So this is Mr. Barry Jones, patient name important, date of birth is very important, reason for presentation: patient came to you because he wants to return to his work after back injury, and his employer is very supportive as well. So medical history, he underwent appendectomy in 1984, but appendectomy has no relation with back pain or back injury, so we will exclude this information. This is totally irrelevant. So family history or social history may be important in this letter. Let's read it. So patient is married and has 3 children. Okay. Work drive forklift in a large warehouse. This is very important information, and require prolonged sitting and occasional heavy lifting. So these information are really important. Okay. So current medication, patient is on naproxen and carisoprodol. Okay. So condition history on 21st March 2015, patient presented with hard back lifting, heavy box of floor at work. Okay, 4 days since initial strain, and no rest, pain is worsening. So on presentation, patient underwent an X-ray which showed no disc problem. This is important again. So you made a diagnosis of lower back pain strain which is severe. So treatment was given exercise and walking daily. You advise on exercise and walking daily, gradual increase in time and distance. This is important. You are going to advise a gradual increase in time and distance of exercise. You also refer to the physiotherapist, and you gave prescription of naproxen and carisoprodol. And in addition, as patient condition was severe and he was unable to do his work, so you also give 30 days of work and certificate to give to the employer. Okay, after 30 days you also scheduled a review visit. Okay, so then on 18th April 2015, patient presented again for follow-up. His back is still sore, moving very stiffy, physio exercise very painful, but patient is very compliant to his exercise and physiotherapy. Exercise walking up to 10 minutes per day. So you extended time off from work and for another 30 days, and you again scheduled a review in 30 days. On 19/5/2015, after 1 month, patient again presented. His back is recovering well, but still in pain, still moving very stiffy. Physio attending regular appointments and exercise walking 15 to 20 minutes per day, but it is very tiring. So because his walking is very tiring, so you increase the naproxen dose, and you further added 1 month off from work for 30 days. Okay, on 20th/6/2015, that is on today's visit, patient presented back recovering well but still in pain, moving stiffy but increased range of movement. So keep in mind that this is range of movements. One of the students, I think, wrote it as restriction of movements. So this is increased range of movements. Pain increase after 20 to 30 minutes of sitting or lying down. Physio still attending the appointments as well. So exercise walking 30 minutes per day, but still very tiring. So you discuss, but patient discuss that he feel bored at home, and he is very discouraged. So he want to return to work because he is very bored at home. So now you are planning for patient that he can only return to work if no lifting there or with regular breaks. Okay, so keeping these points in your mind, you are writing to the occupational therapist and requesting for assessment of his workplace. You are writing to occupational therapist. He will visit or she will visit to the workplace and will assess, and he will advise or he will mention the duties which patient can perform. So okay, so keeping all the information in mind, now we will write the letter. So let's move. So this is address, we have written date, then this is the address of occupational therapist. When we have written dear madam, comma here. Keep in mind that most of the people do that, they put comma after dear madam or dear doctor, but they don't put comma after yours sincerely. Keep in mind that if you are putting comma here after dear doctor or dear madam, then you have to put comma after yours sincerely. And if you don't put comma here, then there is no need to put comma after yours sincerely as well. Okay, so this is reference Mr. Barry Jones, date of birth is this. So let's move. So in this way you will write that I am writing to request. So this introductory paragraph is very important in this letter, as most of the people were writing I am writing to refer. No, you are not referring patient, you are just sending a request letter. So you should write I am writing to request an assessment of Mr. Jones' workplace, who wants to rejoin his work after a back injury. So you will write that your cooperation in this regard and advice on the suitable duties would be greatly appreciated. So your aim of the writing task is workplace assessment and advice on duties. So you have to mention everything. We have mentioned workplace assessment here, and we are mentioning that advice on suitable duties would be greatly appreciated. Most of the people write that I am writing to refer Mr. ABC with the complaint of this. Your urgent assessment and management would be greatly appreciated. No, this is not correct for every letter. Your urgent assessment. You have to you have to read the task, and then you have to read the purpose of the letter according to the task. As in this letter, purpose was workplace assessment and advice on duties which patient can perform easily. So we have written everything here. So in this way you can write a very good introductory paragraph of this letter. So after writing the introductory paragraph, now we will write a social history or any past medical or surgical history that is relevant related to the diagnosis. Keep in mind that most of the people write everything which is irrelevant to the diagnosis. You have to keep the diagnosis in your mind, and then you have to write the information which is relevant to the diagnosis. So here this is the medical history, appendectomy. This is totally irrelevant related to his problem right now, so we will exclude this information. And this is family history, married and 3 children. We can include this information. And work, this is very important. His work is very important in this letter. So he worked as a forklift driver in a large warehouse which require prolonged sitting and occasional heavy lifting. So this is very important. You can also include the drugs he is taking right now, but we have not included in our letter here. So let me show you now that how we will write social history paragraph. So here Mr. Jones is married and has 3 children. He drives a forklift in a warehouse. Please note his job requires prolonged sitting and heavy weight lifting. This is very important. His job requires prolonged sitting and heavy weight lifting. This is very important information. So guys, after writing a social history paragraph, now we will write initial visit of the patient. So let's move to the case note first, then we will write the initial visit. OBC. So guys, after writing the social history paragraph, now we will move to the first visit of patient. So before writing this visit, we will read the case note. So very first visit was on 21st March 2015. Patient presented when he hurt his back while lifting a heavy box off the floor. This was 4 days before, and pain is worsening right now. And on his first visit you did an x-ray which showed no disc problem. So lower back pain with strain was your diagnosis. As a result, you advise exercise and walking with gradual increase in time and distance. You also refer to the physiotherapist, and you also prescribed naproxen and carisoprodol, and you gave a certificate for 30 days off from work. So we will write all these information on today's visit. So let me tell you now that how we will include in our letter. We will write that initially on this date, Mr. Jones presented with a complaint of lower back pain which started 4 days ago when he was lifting a heavy box off the floor. Okay. His x-ray showed no disc problem. Okay, right? Then what you did? Consequently, naproxen and carisoprodol were prescribed along with 1 month off from work, and additionally he was advised on exercise and physiotherapist consultation. So guys, in this way we can include every information which is relevant from the initial visit in a very good way. Okay, so try to write your initial visit properly and try to write connectors like consequently, as a result, therefore, additionally, in addition. Okay, so these connectors make your writing beautiful. Try to use these connectors in your writing. Okay, so students, after writing the very initial visits, keep in mind that now we have to include the visits between the initial visit and today's visit. So let me tell you about that how we will write these visits. So patient presented 2 times between initial visit and today's visit. So we will write both visits in a combined paragraph. Most of the students were writing that on this date, on this date. I will suggest that don't repeat date in your letter again and again. Okay, you should write initially with on this date and on today's visit. In between visits you should mention that subsequently, after 1 month, after 30 days, after 2 weeks, you should write the in between visits in this way. So after first visit we will write these 2 visits which were subsequent visits. So before telling you how to write these visits, let's see the case notes. On this date, patient presented still sore in his back. Movements were very stiffy. He was very compliant to his exercise and he was walking up to 10 minutes per day. So seeing his condition, you extended his off from work for more 30 days. Okay, then after 1 month he again presented with still in pain and movements were still very stiffy, and he was attending his physio and walking 15 to 20 minutes, but it was very tiring. So you increase the naproxen dose because his walk was very tiring, and you again extended his off from work for 30 days. So now on these 2 visits patient complaint was almost same. So let me tell you that how we will write these visits. We will write that on subsequent visits. Here we have written visits, not a visit. It's mean that we are compiling 2 or 3 visits. Mr. Jones reported a minor recovery despite a good compliance to his exercise and physiotherapy. Although in these 2 visits patient was very compliant to the exercise and physiotherapy, but still there was a minor recovery because his back was still hurting and his movements was very stiffy. So we have just written that Jones reported a minor recovery. So what you have done, as a result naproxen dose was increased and he was advised to rest for another 1 month. Okay, so we can briefly summarize the subsequent visits before today's visit in this way. Keep in mind that you have to mention first visit and today's visit in a comprehensive and in a separate paragraph, so that reader or your evaluator can assess that you know how to write in proper way. So guys, after writing the subsequent visits in this way, now we will write about today's visit, and according to the case note, today's date is 20th 6 2015. So before writing the today's visit, we will definitely read the case notes of today's visit. So on today, patient recovering well but still in pain. Movements are stiffy but with increased range of movement. Pain increases after 20 to 30 minutes of sitting or lying down, and patient is still compliant to the physiotherapy exercises. And he walks daily for almost 30 minutes, which is still very tiring. Okay, so patient is now bored with his condition and he is discouraged as well. He presented to you that he wants to rejoin his work or he wants to return his work. Okay, So you said that you could only return to work if there is no lifting and there are regular breaks in his duty. So keeping these points in mind, you are writing this letter to request the occupational therapist that please go to his workplace and assess the working environment. So let me show you that how we will write it now. So you will write that on today's visit, Mr. Jones reported an improvement in his condition with increased range of movements. Okay, so let me tell an important point here. Most of the students miss article "and" here. They write that Mr. Jones reported improvement. No, reported an improvement. Okay, in his condition with increased range of movements and wants to return to his work. Now you will write that please note he is still in pain that increases after 20 to 30 minutes of sitting or lying down. So you have described the patient condition, and you have also described that what is patient wish. He wants to return work, but he is still in pain, and his pain increases after 20 to 30 minutes of sitting or lying. Okay, and his movements are stiffy. So you have mentioned the current condition and patient wish. So keeping these information, the current condition of patient, now you are writing that therefore he could only return to his work if conditions are suitable for him. Or you can also write in this way, he could only return to his work if it includes no heavy lifting or regular breaks. So keeping the patient situation in mind, now occupational therapist will visit and he will check that if there is any job that requires no weight lifting or regular breaks, then he will describe that patient can join his work and he can do this type of works. Okay, so keeping all the information you have written previously, now we will write in a conclusive paragraph. We will write that it would be greatly appreciated if you could visit Mr. Jones' workplace for assessment of the working environment. Okay, so working environment is very important for Mr. Jones. No, he can work only the environment where there is no lifting and where he can enjoy regular breaks. So in this way, I will suggest that you should write your conclusive paragraph precisely. Okay, then we will write that should there be any queries, please do not hesitate to contact me. Yours sincerely. And then you have to leave two spaces. Okay, after you sincerely, leave two spaces and write doctor, and don't forget to put a full stop after doctor. So guys, this was all about today's letter, which was to occupational therapist, and you was requesting about the workplace assessment of your patient who suffered back injury and now he wants to rejoin his work.